Are you tired of waking up every morning with stiff, aching joints? Have painkillers become your daily routine, and yet the pain never goes away? What if I told you that the real cause of your joint pain might not be age, injury, or even arthritis? As a doctor with over 20 years of experience, I've seen thousands of patients suffer in silence, while the real cause of their pain was ignored by mainstream medicine. In this video, I'm going to reveal the 5 hidden, shocking causes of joint pain that nobody is talking about. I'll guide you step by step through the dangers, the symptoms, and most importantly, the natural solutions to reclaim your joints, your freedom, and your life. If you're struggling with knee pain, hip discomfort, or aching hands, you need to hear this, because your body is screaming for help, and it's time to listen. Step 1. The inflammation trap. The real silent killer. Let's start with something I see nearly every single day in my clinic. Meet Sarah, age 42. She's active, eats what she thinks is a balanced diet, and yet her knees are constantly inflamed. Her MRI shows no major damage, but the pain is real. The culprit? Chronic, low-grade inflammation. Inflammation is your body's defense mechanism, but when it goes unchecked, it becomes your worst enemy. Processed sugars, seed oils, like canola and soybean, and even foods marketed as healthy, like whole-grain cereals and fruit yogurts, can trigger a systemic inflammatory response. Shocking fact, some so-called heart-healthy oils are inflaming your joints every day. They sneak into salad dressings, granola bars, and even health shakes. The damage is cumulative. Over time, the joint lining becomes irritated, cartilage wears down faster, and you feel older than you are. Solution: switch to anti-inflammatory fats, olive oil, avocado oil, wild-caught salmon. Eliminate refined sugars. Introduce turmeric and ginger daily. These are natural anti-inflammatories proven in clinical studies. Step 2. Autoimmune confusion. When your body turns against you. Pain without injury? It might be your immune system attacking your own joints. Conditions like rheumatoid arthritis, RA, lupus, and psoriatic arthritis are autoimmune diseases. They mimic general joint pain and are frequently misdiagnosed as aging or wear and tear. Here's the twist. The root cause is often gut permeability, also called leaky gut. Certain foods, particularly gluten, casein in dairy, and glyphosate residues, damage the intestinal lining, allowing undigested particles into the bloodstream. This triggers the immune system to launch an attack that accidentally targets joint tissues. Example: a 35-year-old patient of mine suffered for years with wrist and finger pain. After removing gluten and processed dairy and adding probiotics, her symptoms reversed within 90 days. Shocking truth: you could be attacking your own body 3 times a day, at every meal. Solution: remove inflammatory foods, support gut repair with glutamine, zinc, and bone broth. Consider a 21-day elimination protocol. Step 3. Toxins and heavy metals, the poison in your pantry. What if I told you your joint pain could be linked to the plastic water bottle you're drinking from, or the tuna sandwich you had for lunch? Heavy metals like mercury, lead, cadmium, and arsenic accumulate in joints and connective tissue. Pesticides, industrial toxins, and plastic residues, like BPA, sneak into your food and water every day. Case study. One of my patients, a 50-year-old man with unexplained hand and elbow pain, was found to have high mercury levels. He ate sushi 3 times a week. After a 3-month chelation and detox protocol, his pain disappeared. Solution: detox the body using natural binders like chlorella and cilantro. Use glass containers, filter your water, reduce fish high in mercury, like tuna and swordfish. Shocking reality: detox isn't a luxury, it's a necessity in today's toxic world. Step 4. Nutrient deficiency. Starving your joints from the inside. Your joints are living tissue. They require raw materials to regenerate and protect themselves. But here's the hidden truth. Millions are deficient in magnesium, vitamin D, omega-3 fatty acids, and collagen, and they don't even know it. Why? Poor soil quality, over-farming, low-nutrient processed food, and gut malabsorption. Step 4. Millions are deficient in magnesium, vitamin D, omega-3 fatty acids, and collagen, and they don't even know it. Why? Poor soil quality, over-farming, low-nutrient processed food, and example. One of my patients had knee pain for 5 years. Blood work showed vitamin D levels at 14 mg/ml severely deficient. With supplementation and omega-3 oils, her inflammation markers dropped and her pain improved in weeks. Shocking reality. Your multivitamin may be completely useless if your gut can't absorb nutrients. Solution: get tested. Focus on absorbable forms: magnesium glycinate, D3 with K2, marine collagen peptides, and fish oil. Add fermented foods to heal your gut. Step 5. Posture misalignment and stress. The structural breakdown. Do you sit all day? Slouch at your desk? Carry stress in your shoulders? All of these habits contribute to postural misalignment, which shifts your joint mechanics, leading to chronic wear and tear. Tight hips pull on knees. Rounded shoulders compress cervical nerves. Poor sleep posture stiffens the spine. Stress adds fuel to the fire, raising cortisol levels that inflame joints and slow healing. Solution: posture correction with ergonomic chairs, lumbar support, stretching routines, and joint-friendly exercise like water aerobics or Tai Chi. Dr. Tip: get a posture evaluation. Your pain might be from your feet or your neck. Bonus step: medications that secretly worsen joint pain, NSAIDs, ibuprofen, naproxen, are the go-to pills for pain. But did you know they can actually damage the lining of your gut and impair cartilage regeneration? Statins, prescribed for cholesterol, can cause muscle and joint pain. Blood pressure meds can deplete magnesium, leading to cramping and stiffness. Shocking reality. Some medications mask pain, but worsen the root cause. Always ask your doctor about long-term effects. Solution: never stop meds without medical advice, but explore alternatives. Address root causes, not just symptoms. Final step: doctor's healing protocol. Natural action plan. To begin reversing joint pain naturally, here's my personal protocol I've given to hundreds of patients. Anti-inflammatory diet: leafy greens, berries, olive oil, wild salmon. Avoid sugar, seed oils, gluten, dairy, initially, supplements, omega-3 plus K2, magnesium, collagen peptides, curcumin detox routine. Sweat therapy: proteosin, diasin, binders like activated charcoal, liver-supporting herbs. Movement therapy: water aerobics, Tai Chi, yoga. Walking daily. Stress management, deep breathing, mindfulness, adaptogenic herbs, ashwagandha. Sleep hygiene, 8 hours, screen detox before bed, magnesium at night. And ending in emotion. I want you to remember this: joint pain is not just a symptom, it's a message. It's your body crying out for change. And today you've learned the truth that most people will never hear in a 10-minute doctor's visit. You have the power to turn your pain into healing. The path starts with knowledge, but it ends with action. And if this video helped you, share it. Because someone else is suffering in silence, just like you were. You're not alone, and you're not broken. You're just one decision away from healing.